Pharmacist, and I am here. I'm so excited to share with you the spunkiest prednisone warrior I've ever talked to. This is Shana, and she has so many different perspectives on prednisone than I've ever been able to share before. Not only is she personally taking it right now, but she's a nurse and she's training to do a triathlon. What? Hands down crazy. So here we go. Take it away, Shana. Introduce yourself a little more.
Hi, everybody. I'm Shana Dagny. I'm an actress, singer, a dancer. I am training for a triathlon. I am also a nurse. I've been a nurse for quite a while, and I've had asthma all my live long life. Right now, I'm actually on prednisone for very bad asthma. I've been on it for this course, at least for the last 3 weeks, very high doses. We'll get into the doses in just a bit. And I have not taken my dose today. So during this interview, we'll just see how uncomfortable I get. I'm going to go ahead and take today's dose, see how quickly this drug responds, and see how quickly I get the side effects right after I take the drug. So we have Dr. Megan Milne on YouTube and on Instagram. And right now we're doing a live with all my friends and followers and people who are interested or want to know a little bit more about the drug prednisone.
All right, let's do this. Swallow that pill.
Swallow a pill. All right, so I actually, so I'm training for the triathlon. These are what these little puppies look like. The code on it, at least in the United States, one side says Dan, it's scored, so you can kind of cut it in half. It's 5442. Different people make in different shapes and sizes, but the one I typically get, which I feel psychologically is the most effective, is the one that's very hard to swallow because it's so bitter.
So bitter. Oh. So swallowing it down with some water. Here we go. Oh, misery.
I typically choke on these at least once a day.
Mm-hmm.
And I'm down to 30.
Oh man, it tastes so terrible. If anybody's wondering what it tastes like, it's like this bitter metallic-y, yucky taste.
I'm not good at swallowing pills either.
It's tricky.
This is great because it's only 3. Like a couple of days ago, it was 6. I was taking 60 milligrams. My followers who know what prednisone is, they're like, "Oh, it's bitter. It's bitter."
That is so much.
One of them are asking. One's asking, "Why is it bitter?"
That's a good question. I don't know actually why it's bitter. I can guess. One of the characteristics of the drug is it's a mineralocorticoid. That means it's like a mineral and it's this bittery taste. I don't know though. That's a really good question. I'm gonna have to research, find out.
They should like coat it in cherry. It like sucks everywhere else. Like why make it hard to swallow? Literally.
Yeah.
Okay, I took that a couple of seconds ago. I was just clearing my throat, kind of like shaking up my chest because it's very heavy. It's very tight. I feel like someone's got their hand around my throat or, just grabbing my lungs, or like I'm carrying a 40-pound backpack in Europe without the fun.
So that is a fascinating way to describe asthma. But if anybody hasn't had asthma, that's what it feels like. It's just tight. It hurts and it's scary. Like it feels like, am I going to survive? Am I about to die because I can't breathe?
Yeah. It's like walking hell.
It is. So why do you think you're feeling tight today?
Well, so I'm a swimmer, but I'm a new swimmer. I learned how to swim just for the fun of it and to kind of combat, not depression. I'm not like diagnosed or anything, but like when I was going through some hard stuff in my life, I decided I'm going to learn how to swim. It's a new skill. Plopped in the pool, and then started getting sick on like the days I would swim. And later on, I realized that there's this chemical above the pool called chlorpromethine, not sure, but it prevents mold from growing in indoor pools, prevents like bacteria from developing in enclosed indoor spaces. Great for sanitation, horrible for people who have asthma. It's very caustic to the inner lining. And when anything kind of irritates the inner lining, it just, you know, you're chronically in that state, especially if you keep reintroducing yourself to it. So I got really sick from that back in 2019, where I went on prednisone for 3 months, like really high doses. And then I recovered from that. I didn't think I would, because it was kind of grim. And then I decided, let me go back into the pool again a month and a half ago. And it started this, and it's been very hard to get out of it. There hasn't been any bacteria, like not an infection, like it's not, there's no signs of that. So I went back to my allergist. He put me on prednisone. He doesn't go as high on the dose as my ear, nose, and throat doctor does. I went back to my ear, nose, and throat doctor, and he started me on 60 milligrams about 3 weeks ago.
Wow, that is so high. Like that is like knock it out of the park.
Yeah.
We're serious. Something's life-threatening here when you're on 60 milligrams.
Yeah, 60 milligrams. What is it like? Is there like a 1 kilogram, 1 milligram per kilo of weight?
Yeah, 1 milligram per kilogram. So a 120-pound person would be getting roughly 60 milligrams, somewhere around there. And so if you're going for that high dose, 1 meg per kg.
Yes. And so he does like a 5-day taper. He goes 60 milligrams for 5 days, then 40 milligrams for 5 days, and then 20 milligrams for 5 days, then 10 milligrams for 5 days. That's not been working so well, because as soon as I drop, the asthma comes right back. Side effects go away, which is great. But that feeling comes back.
Yeah, it's so tough to find that balance of having your disease coping, but having not the amount of side effects you're hoping for. And it's like, do I want to totally breathe without any problems and deal with side effects, or do I want to have trouble breathing and have less side effects, right?
Yeah. Yeah.
Oh, misery. Such a tough spot to find the perfect dose to get you to cope.
Yeah. And I'm doing the triathlon next weekend. It's the Chicago Triathlon. It's actually one of the largest attended triathlons in the United States.
Wow.
Yeah, largest attended triathlon in the United States. So that is, yeah. I gotta push through. I'm not breathing great every day, and I'm sleeping because of this drug, and I'm in pain, and I'm uncomfortable. I'm freaking gonna do it. I'm gonna do it.
You're gonna do it.
Yes.
This is another, what is it, 10 days until the triathlon.
Yes.
Wow. You can do it. It's worth it. So how does a person do a triathlon while on prednisone? Because it seems like a lot of people be like, oh, I'm too sick, I can't do a triathlon.
Yeah. That's what a lot of people, I think maybe most people would say that. I don't know. I haven't gotten like the statistics on it. This is the first time I'm actually doing something athletic. And I started this, if I can like talk really quickly about my Instagram channel. It's called
Please do.
Yeah, great. It's called the How to Find Happiness Experiment. When 2020 started, I'm a mental health nurse, and you know, I handle depression, anxiety, and suicide prevention or management rather. And when 2020 hit, even people who were not clinically diagnosed with depression or anything with mental health just kind of acquired that diagnosis. There were more suicides per, week than I had ever managed. So I figured there must be something with like happiness and the meaning of life and things like that. And I was going through my own search for, sounds so know-it-all, but I was trying to find it for myself as well. And everybody says self-love, self-care, take care of yourself. They don't tell you how. And you'll hear things like go to the spa or have a glass of wine, and you can only have so many glasses of wine before other things start to happen, or you can only go to the spa so many times. There's only so many services at the spa. So I figured every day I'm going to try and figure out one thing specific to do, or that that will somehow maybe elicit happiness. And one of them was become a triathlete. There's no backing to it. Someone just suggested it, and I'm like, well, I'm not athletic, and oh, okay, why not?
Why not?
And part of doing something is learning the habit, acquiring the habit. So I get a lot of flack for like working out when I'm sick, not giving myself a rest day. People telling me to slow down. I think for me personally, and maybe for some, if you are not in the habit of things yet, a habit is one of the easiest things to break. So if you're not feeling well and you work out, you strengthen that habit. Versus if you're not feeling well and you say, I'm gonna take a day off, you promote breaking that habit. So the next time you feel anything similar to like an off day and you take off, then you'll create the habit of like pulling back or not giving in your all. And I don't want to take anything away from recovery time because it's great, but if you just kind of test the limit, you're gonna fall off and you're gonna hurt yourself eventually, but at least you know what that point is. And so that's why I am training. That's what it's like to train while sick. Yeah.
It seems like it's the same struggle. Like, okay, I got to keep this habit, but I also can't get sicker, right? Like,
yeah,
finding that fine line between getting sicker and staying strong with your habit and your healthy habit that is going to help you recover, because it can worsen it, but it can also help you recover. So it's like you keep finding those nuances, and that's the trick, is
you
deciphering your path through that nuance.
Yes, and it's exactly like how you gestured it. It's not this or this, and it's definitely not black or white for everybody. You have to figure out your own fine line. Like, do I want to do the habit today, or do I want to preserve my energy? Like today, I swam today on 2 hours of sleep. Yesterday, I swam on an hour of sleep. I will probably get sleep at some point when I really feel like I can't do it anymore. And then I'll feel great. But right now I'm going to stick to, and after the swim, I felt fantastic.
Mm-hmm. That's awesome. So sleeping, oh man, high dose prednisone and sleep. It's just not a great combination.
No. I do have some questions for you later on certain symptoms that I'm like, why would this symptom come up from a physiological perspective?
Shoot, go ahead.
So I've been documenting my symptoms every day, like day 1 on 60, day 2 on 60, day 2 on 40 milligrams of prednisone. One thing I noticed is that when I started the 60 milligram prednisone, I felt like something was choking my neck, like there was someone who had their hands around my neck, and then I kind of like lost my voice. Now, as a singer, I know they don't like giving prednisone to singers because it can cause vocal hemorrhaging or hemorrhaging of the vocal cords. So does that have anything to do with that, like spasm of the trachea or spasm of the larynx when you take too much prednisone, or is that something?
I have never heard of that.
Well, now you have. And I was getting the hiccups. I was like,
okay, I have heard of hiccups.
You have
definitely heard of hiccups, but I have not heard of like laryngeal spasms or anything. Okay. I mean, I'm wondering if that's something to do with the asthma. Like, that's the other weird thing about prednisone is it a side effect, or is it something to do with your condition that you're taking the prednisone for? It's so hard to figure out the difference.
Why does it cause, do you know why it causes hiccups?
I have no idea why it causes hiccups.
Okay.
And it's super rare that most people don't get hiccups.
Yeah, I got the hiccups. And then I also got, like for a couple of minutes, I felt kind of deaf.
Deaf?
Is that like toxicity or?
Oh my goodness. Okay, so also haven't heard of that. People actually take prednisone for like deafness or
I guess.
balance issues.
Yeah.
Like that's why they're taking it. So you have some unique side effects. I haven't heard of these ones.
I've been also documenting it, so maybe it's like a little bit more detailed, or
Yeah.
yeah. Yeah, what other questions do you have? I'm seeing some of your questions here.
So you told a little bit what you've been prescribed this time. When was the first time you took prednisone? How long have you been taking it, like over your lifetime, kind of a thing?
I mean, my brother and I both had asthma growing up, so we're familiar with the drug. And you know, we've been taking it off and on. After puberty, like I did not have asthma for a whole like 15-year stretch, and it came back as an adult.
Oh, so you had it as a kid, but you had a nice break, and now it's back.
Great, yeah, good run, good 15-year run, and then it just came back with a vengeance. And then there was 1 year where for 10 months it was off and on. Prednisone was really bad. I would get sinus infections. And then the same ENT that I work with now, he started me on the prednisone, but he also said we were going to do endoscopic sinus surgery because my allergies were just causing a chronic buildup of like mucus within my sinuses that irritated the lining, that triggered the asthma, that then precipitated the constant antibiotics and the prednisone, the high dose. And it was an awful quality of life. I quit work. Yeah. I was indoors and just gasping for air pretty much 24/7. After the sinus surgery that reset my body, and I went from like 10 months a year sick to like maybe every 3 months getting sick, with a good 2 to 3 month break in between. My allergist finally put me on this drug called Dupixent.
Oh, nice. That's a good one.
Yes. I don't know how well it's working yet. Like, obviously, it's not the magic pill right now. So the fastest is still really prednisone.
Yeah. Prednisone is a true miracle. Like, it does miracles. Like, it saved my life. Like, I was almost about to bleed to death, and prednisone saved my life. And so I thought I needed to help other people on prednisone because it was so miserable.
Yeah. Okay. So this is a great, I got to ask you this question, like right at this point.
Yeah.
You call yourself the Prednisone Pharmacist. So tell me about that journey. Tell me about like what, I'm guessing you have a success story with prednisone. You hear a lot of people complain about prednisone, but I don't know anyone. And it's such a big deal for people who take it. It takes over their lives in both good and bad ways, but no one talks enough about it. So what is the, what brought about your expertise to prednisone?
So I was just this mother of 4 little kids, a pharmacist, and then suddenly one day I got this crazy rash, and I was like, what the heck is that? I had 2 antibiotics prescribed recently, and I was like, is this a weird like rash to an antibiotic? Turns out it wasn't. They took my blood after me begging them to at the dermatologist and said, oh my goodness, your platelets are down to 12. And for those of you who aren't medical experts, normal platelets are 150 to 400, and I was at 12. And so I was basically a ticking time bomb for like bleeding to death. If I'd gotten in a car accident, they wouldn't have been able to stop me bleeding. And so they prescribed prednisone after checking my blood again in the emergency room, and it was 3 platelets. So I was literally going to die if any reason caused me to bleed. So prednisone was a complete miracle because it took my platelets from 3 up to 160 in like 3 days. I was in the safe zone. I was no longer at risk for bleeding. And I was like, I got this. It's just like 10 days and I'll be fine. And then 9 months later, I was still on prednisone, and it wasn't fine, and it was not fun, and I hated it. And they gave me 2 options. You can have a splenectomy to get rid of your, by the way, my diagnosis was ITP, that's immune thrombocytopenia, where my immune system was attacking my platelets and killing them all. And they said, you can either have a splenectomy, which is removing your spleen, surgery to like take it out of your body, or you can have chemotherapy. I was like, those aren't great options. I don't want to do either of those. Eventually went with the chemo, and it did work, putting me into remission. So I was able to go off the prednisone. And one of the days when I had just finished high dose prednisone and my Rituxan infusion,
Yeah.
I was staring at the ceiling thinking, this is the most miserable thing. I can't sleep. Even though I didn't sleep all last night, I can't do anything. There has to be something better. And so I had an epiphany that there is a better way. Like, I invented a supplement for people, and then I became the prednisone pharmacist. So I could help people. I have hundreds of YouTube videos and
Wow.
blogs, and
Wow.
nobody else is ever talking about prednisone.
Okay, so wow, this is blowing my mind. Okay, so you came up with a supplement. Can you tell me more about that?
Yeah, because I think most healthcare professionals know that prednisone causes osteoporosis.
Yes.
Yeah, most people get that training, and that's because prednisone is leaching calcium and vitamin D from the bones. And
my bones hurt.
what was that?
Is that why my bones hurt?
That is definitely related.
Yeah, my knees hurt, my fingers hurt, my toes hurt.
Yep, I had knee pain. It was so weird. Like, what? It's, the side effects are so weird. But yeah, it's because of the calcium and vitamin D depletion. That's why it causes osteoporosis. And then I didn't know that the other side effects could be related to other nutrients that prednisone's depleted. And I was shocked when I found out that the high blood sugars that cause the weight gain from prednisone are totally related to the chromium. Chromium is this vital mineral in our body that prednisone is making go away. And so you need chromium to have proper blood sugar balance.
Wow.
And it's just gone. Like, so you just have these climbing sugars. Like, I've had 5 babies now, and I've had that gestational diabetes, like sugar swallow nastiness, where they test your blood sugars to see if you have diabetes. And I passed all of those with flying colors. Never got anywhere close to the level of blood sugar that would cause diabetes. But while I was on prednisone, I was out. I was in the, like, I was 109 fasting. Like, that's not good.
Yeah.
And so it's just messing with all of these different nutrients. And so I found all of this research, 75 articles to support all of these different ingredients, and invented this supplement called Nutranize Zone. And so I've got tons of research supporting every single ingredient, and people just take 2 in the morning and 2 at bedtime. And
what's it called?
Nutranize.
Nutranize.
Yep.
Nice. And it's basically, it balances you out if you are on a drug like prednisone.
Yep.
Okay.
Yep.
So it supplements the chromium loss. So what happens to the chromium? It leaks from your,
you pee it out,
and then you pee it out. Wow.
Yep.
Wow. That's fascinating.
Yeah. So it gives all of those back, and people are like, I feel like myself again.
While you're on the drug.
Huh?
Oh my God, that's okay. And so does it kind of take care of some of the side effects, or how does that?
So I can't like say that in my marketing. But I did, like, that was the purpose of inventing it. Like, I originally called it RX side effects. That was my cool name I came up with. But then I discovered you can't actually say RX on the supplement, because then people think it's prescription.
Even if it's a small letter R?
Yeah, right? And so they're like, you can't do that. I'm like, oh, okay, well, Nutranize then. So my whole goal was to counteract the side effects. And so I can't actually say that in my marketing messages, but that's exactly why I invented it. The insomnia, I've got 3 ingredients that help with insomnia. The high blood sugar, I have 3 ingredients that help with that, and which in turn helps with the weight gain.
Yeah.
And so it's just, people love it. And I've had people on it for 2 years now. Like,
So
straight.
do they take it only while they're on prednisone, or do they just, it's safe to take throughout the year?
Yeah, I mean, so I'm personally still taking it, even though I stopped prednisone a couple of years ago, because it just makes me feel good anyway. So, but you only need it while on prednisone, but I invented it to reduce your suffering by replenishing your nutrients so that you can recover from prednisone. So most people stop taking it once they feel recovered from prednisone.
Okay. And there, I mean, that's, so the insomnia is a big side effect. The blood sugar is a big side effect. So what are the other, I guess, what are the other, essentially or functionally, the other side effects that Nutranize, right?
Yeah, the Nutranize substance. Yeah, so along with that, those are the two biggies for sure. Then there's like heart disease and all sorts of long-term complications that are terrible. And so there's several ingredients that help keep your system stable so that you don't have so many long-term
it doesn't eventually develop.
Yeah, and then the first one I mentioned was the osteoporosis. So there's osteoporosis, insomnia, and weight gain. Those three together are the main ones that it's invented for.
That's fascinating. So this comes to you while you're miserable. You know what, like sometimes that breeds the most creativity is when you're like really like you're pushed to a wall.
Yeah, I was pushed to my complete extreme and I had nothing left. And it's like, oh, this is what we all need. And it's helping so many people now.
Wow. Slight segue, but I know I had this in like my pharmacy or my pharmacology class, but is there any risk to like women taking prednisone who are like planning to get pregnant or are pregnant? Is there like a risk category for prednisone?
Yeah, so it all depends is the question, is usually the answer for every question to prednisone. But the doctors who take care of women, called OBGYNs, they say their big organization, ACOG, American College of Obstetrics and Gynecologists, say that prednisone benefits outweigh the risks to the fetus. And same with the American Academy of Pediatrics. So if the mother is suffering serious asthma or multiple sclerosis or something where if that condition goes untreated, it's going to cause harm to the fetus, then it's definitely worth it. There are theoretical risks, but there's actually no evidence of harm to babies. They just can't say it's perfect, you know, like they can't say that, or I don't know, people get sued.
Correct. Okay, quick segue back to Nutranize. How do people, I know you have a YouTube channel. What's your YouTube channel called? How do we get Nutranize?
Yeah, so my YouTube channel is Dr. Megan, Prednisone Pharmacist. And so if you just search Prednisone and Dr., you'll find me, Pharmacist. Then Nutranize is available at nutranize.com, which is nutranize.com. And it's just the two bottles. They come shrink wrapped together like this. And
are they capsules or tablets?
They're capsules. Yeah, I can show you one.
So they're easy to swallow for someone.
Yeah. Okay. So I wanted to talk to you about swallowing pills because
you have a technique for swallowing pills?
Yeah. So I mean, okay. So here are the capsules.
Yeah.
There.
Oh, perfect.
So they're capsules. That was the bedtime one.
Yeah.
And so I learned this recently, not in pharmacy school, but that tablets, if you like swallow them by tilting your head back quickly, it helps because they're heavier than water, right?
Like, oh, so they will sink. Yes.
They will sink. And so, and then if you kind of do them all at once, it's like swallowing a bite of food, you know?
Okay. Right. Like a bolus of food.
Yep.
Okay.
Then you're done. Whereas capsules, float in water, right?
Yes. Yes.
Because they're so like
They're
just the
light.
shape of them, they're lightweight. They're like a little boat just floating in water. And so you don't want to tilt your head back. You actually want to tilt your head forward when you're swallowing because it'll help the capsules go down.
Float like right over the oropharynx. Wow.
Yeah.
Okay.
Cool, huh? I had no
Yeah,
idea.
that's cool. So for tablets, rock your head back because they're
Yep.
heavy or they're dense and they sink. For
Mhm.
capsules, tilt your head forward a little bit so that because they float.
Yeah.
That's so cool.
Yeah, I had
I'm
no
gonna
idea.
try that tomorrow. I don't know if you're noticing, but like I feel so much better now. This is I don't know how many minutes after.
I don't hear you wheezing. I don't hear you
Yeah,
coughing
I'm
anymore.
not really, and it's easier to talk. My voice feels lighter. It's airier. It's just that's the effect of prednisone, and that's how at least 30 milligrams for today. That's how long.
Mhm.
That's how long it. That's the onset of the action of the pill. I do have. Do you have questions for me? Because I have like a whole list.
So we already talked about training for triathlon.
Yes.
Let's see. At the end, I want to know what you would tell others to expect about taking prednisone.
this like when you're like you're so miserable you just have to laugh.
Yes. So miserable you have to laugh. I love that.
I have this friend who's really tall and we train together and he checks on me every night and he's like, how are you feeling? How are you feeling? How are you feeling? But I mean, I'm on Instagram. I'm constantly pushing material out and it's positive, it's reinforcing material. And a lot of the time it's to remind me to be like, don't allow a negative thought in right now because there's stuff to do. So I'm compartmentalizing. So we go for a run and I'm smoking him on the run. He's smoking me on the run. And he's like, people are going to hate you because here you are, you're running and no one will believe you're sick. And I'm like, I'm miserable. Trust me, I'm miserable. I'm like, my heart rate's going up to 190 on like, yeah. Yeah. And for those of you who don't know, that's high. 190 and but I'm still doing this every day. I feel great afterwards, but it's at night. I'm single, like that's my relationship status. But there are moments where I'm like, it would be great to have a boyfriend to just cry to, or like have rub my back because I can't breathe. And with the side effects, like my bones hurt and I have this pounding headache and every once in a while I'll feel like I'll go deaf. And I'm big on like fancy dresses and looking great. And you don't know me, but I know me. I look in the mirror every day and my face just keeps getting rounder and rounder and it sucks. It sucks.
Yeah, because you're a performer, right? Like
I'm a performer, yeah.
You're part of the way you sell yourself is with your appearance, right?
Yeah.
Like
yes.
You hire me because I'm going to perform and I'm going to look a certain way. And it's really hard to cope with that, right? Like psychologically that I don't look like myself in the mirror, right?
Correct. Yeah. The other thing that I don't like is that every time I get on this drug, all I talk about is this drug. I don't know if that is the same experience you've had with your patients or you yourself being on this drug where you fixate on the side effects and you fixate on the therapeutic effects. It's like right now, like, oh, I feel great. I'm breathing. I'm not, clearing my throat anymore. And then the one last thing I've noticed on prednisone is that it has the capacity to sever and like completely devastate relationships.
Yes. Oh man.
So
sounds like you have a story there.
I have several. I have several. So I don't know if you know anyone like that or like what, if you can, I guess, offer any advice to the person going through the mania of prednisone. There's a funny meme online where it's like, you'll understand only someone who's been on 60 milligrams of prednisone understands what it's like to scrub the oven clean with a headlamp at like 3 in the morning, or try and open a jar of pickles and burst out in tears because they can't do it, or, you know, crave cake and eat the entire cake at like 2 in the morning. So if you have, do you have any like stories about that, or advice for people who are the prednisone victim, or the prednisone like family of the victim?
Yes.
Or the victims themselves because they're around the people taking prednisone?
I have a whole video called "What I Wish My Family Knew" about prednisone, because you really can't control it, and like you become a different person, and it's really hard. And so I think the number one thing is to communicate. Hey family, I'm taking prednisone. And coworkers and anybody who needs to deal with your moods, because they need to have a context, because we can have peace when we know why, right? Like, okay, it's the drug, it's not her. I get it. You know, if there's a reason, or if it's just out of nowhere, it's so hard to comprehend. And it's like, oh, they really must hate me. But where it's, hey, I'm on 60 milligrams, I might not be myself for the next few weeks.
Yeah.
So please just, whatever I say or do, take it with a gigantic grain of salt, because it's just not me, right?
What causes that, like pharmacokinetically?
Yeah, so what prednisone is a mimic of our hormone that naturally is in our body called cortisol. And cortisol our body releases in times of stress, and like a tiger chasing you, or a famine, or like serious stress, we have this natural cortisol release that will save our lives. But Mother Nature is saving our lives at a huge cost. And that is not prioritizing things that aren't going to save our life right then. So it's stealing from our bones, it's stealing from our muscles, it's, you know, causing that high blood sugar so that we can have the energy to run away, right? It's causing the bone loss so that we have all of these nutrients available to survive that famine. And all of those released nutrients, all of those emergency situations are like, Mother Nature's like, look, you just have to survive. I don't care if you have interpersonal relationships right now. You just need to get away from that tiger. And so you're paying all of these costs to survive that moment. The costs mentally, the costs on your bones, the costs on your muscles. And those costs are worth it if you have a life-threatening condition. But they're not worth it if it's always a question of benefits outweighing the risks. Always.
Correct. So so it's the increased cortisol levels that make people
Roid rage.
Rage. Yeah. So that's a real thing. Like the rage is a real thing. I have definitely not yelled, but screamed and broken things while on the highest doses of prednisone.
For sure. Yeah.
And then as soon as I taper off, there's a huge energy drop, and it feels like the life has been sucked up for me.
Mm-hmm. I mean, it literally has. It literally has been sucked from you.
Wow.
You sucked it from yourself by taking that drug, right? Like you sucked all this vitality out of you to survive. It's kind of like if there was like a magic fantasy show where they're stealing magic from someone else to feed their own.
That's what it is.
That's what prednisone's doing, right? Like,
so how does, like, what is it like, where does the anti-inflammatory effects play in? Like, okay, so it creates all this leakage of, and makes these elements bioavailable for us to eventually use, but where does the anti-inflammatory aspect of it come in?
Yeah, so if we need to run away from a tiger, we don't want to feel the pain of running away from that tiger. We just want to run. We just want to get as far as we can.
Correct.
To survive. And so Mother Nature turns off those signals through that high cortisol, just turns off hey, there's all of this pain. And so there's a normal cascade of inflammation that happens that is helpful to heal the wound or whatever caused that inflammation. And Mother Nature's saying, we're just not going to run that cascade right now. We're not going to fix anything. We are just surviving. We're just getting away from this emergency. And so I'm just going to put a stop to it. I'm not going to allow this inflammatory mediator to be released, and then the following one, and then the following one. It just stops it at the top so that they just don't even happen. The inflammation is there, like at the very top level, but the cascade isn't happening, right? And so I think your mom asked, does it cure asthma? And no, it doesn't cure asthma, because the source of that inflammation is still there somewhere, right?
Yes.
For you, it's that chemical. For other people, it could just be running, you know, whatever that source of the inflammation isn't cured, but the cascade is halted.
So it kind of puts a stop to things before it can kind of get the ball running on that.
Mm-hmm.
Okay.
Yep.
What are so you obviously have a success story with prednisone. I'm just curious because I know it from the asthma perspective. How does it cause platelets to kind of like climb up again? Or was it because you had an autoimmune disorder and we'll talk more about that.
Yeah, so with my autoimmune condition, ITP, they used to call it idiopathic thrombocytopenia purpura, and idiopathic is a fancy word for, we have no idea what causes this. It just happens. We don't know why.
Like idiopathic pain or,
Yeah, they had no idea why it was idiopathic. Now they know it's immune thrombocytopenia. They changed what ITP stands for. And so they know it's immune, the immune system's causing it. They still don't really know much more than the fact that it's the immune system causing it. And so somehow my immune system went haywire and started attacking the platelets, killing them.
You were an adult already.
Yeah, and it happens a lot in children too. So like there's the pediatric ITP, and then there's the adult ITP, and they're similar, but there are some things that are different about them. And so, yeah, mine happened when I was 33. So
wow.
Out of nowhere. And so, yeah, the prednisone just kicked my immune system and said, no, stop, stop attacking. But as I would like go down in dose, then my immune system would be like, oh yeah, I hate platelets, kill them all. And so I would just do this roller coaster, like trying to find where the platelets would keep climbing and where the side effects would stop. And it was just miserable.
I'm kind of there too, because I dropped down to 30 about 3 days ago, and I couldn't breathe, and I was just miserable. And my allergist said, go back to 40, stay on 40 till you feel like you're coasting again, then we'll drop it down a little bit lower. But I want to get off of it as soon as possible because I feel it. How high of a dose have you had, and how low? What was your your good dose, or what did you find when you were balancing that out?
So with my condition, they kind of used the prednisone as like a bomb to just kill the immune system.
Nuke it, kept it.
Yes, exactly. To see if it would just kick it back into gear. So the first dose was actually 60 milligrams that I took. I took 60 milligrams per week, and it worked until they started going down. What was that?
You took it for a week.
Mm-hmm. And then when I started going down, then the platelets started going down. And so they're like, okay, let's forget the prednisone. And they put me on a drug like it called dexamethasone.
Yes.
And when they use dexamethasone for ITP, they give a gigantic atomic bomb size dose. So the equivalent is like 225, I think that was the equivalent, milligrams of prednisone.
Wow.
Because it's 10 of the highest strength pills every day for 4 days. So it's just like, let's explode your immune system.
Yeah.
Like you don't need one anymore.
And did you feel like side effects from that, or did you feel more relief than side effect?
Well, so what's weird about it, ITP is like, you can't feel it happening.
Just a rash.
It's like only a rash if it's like super low. And so if you are in a danger zone, you don't necessarily know that until you're like bleeding to death.
Yes. Yeah. That's
And
true.
so that's what's crazy about ITP. And so I had to get my blood drawn at least once a week, if not several times a week, to just find out how bad is it really, because the symptoms don't happen until you're about to die.
Yes.
And so that was the trickiest part, was I have to get my blood drawn several times a week, dragging my kids along with me to the lab. Like, that's fun. Mommy, why are they poking you? Like, no.
Wow.
Oh, so
That's character building.
yeah, that was my highest dose, was like 225 milligrams. And then I did this roller coaster where I would go like to 40, and then somewhere around 20 to 15, my platelets would crash. And so I was hovering between 40 and 20 for most of those 9 months I was on it. Yeah, it was
And then
miserable
you eventually got off of it
because of the chemo. Yeah.
because of the chemo. That's another good drug. I mean, I'm a chemotherapy nurse, so psychiatry and chemo infusion. So
I would love to hear from your perspective, the psychiatry part. What advice do you have for people on prednisone?
I would say, I've been listening to this YouTube video. I think a lot of people in like AA or, going through shared suffering, and even if it's enjoyable shared suffering, like a triathlon, you can feel very alone, and the compounded effect of feeling very alone, makes a difference. Or when you don't feel as alone, it makes a difference. And then you can kind of like, oh, it's no big deal. She's kind of had it worse, or I have it worse, but she's there or he's there. And so to kind of look for community like this. And so it's great that you're, with Nutranize, I'm sure you felt alone and miserable, but like, years later, here you are, and we're having this conversation, which is great. And I suddenly don't feel so alone. So whoever is out there on prednisone, it gets better.
What if they're having side effects that are like mental illness, like the mania or the serious anxiety or incredible depression that just arrived out of nowhere? Is that like, do you think that's from the prednisone? And if
that's
they have
from
it,
the
what should they do?
right now? I'm feeling incredibly unattractive. Like, I'm feeling incredibly unattractive. I'm in this gym full of good-looking life forms of the other gender, and I make it a point to look. I'm so fickle like that. I make it a point to look good, but now I don't. And on top of that, I sound crazy on this drug. I feel like I sound crazy in this drug, but I know it's only because of this drug. And it's like when you're riding a bike and you're learning to ride in uneven terrain, and there's bumps along the way, and ooh, I'm gonna fall and really hurt myself. Or there's a possibility I don't fall if I just expect it and roll through it. Just see what I do and just roll through it. And most of the time, if you just roll through it and just go, okay, this is what it's at, let it play out, it's not gonna be ideal. It's not gonna be normal, but you just let it happen. And eventually you'll run your course. And if you don't run your course, then you go on dexamethasone, and you just work on getting rid of the main problem, and you kind of just take it.
Yep.
I know that doesn't sound like great advice.
Well, I think that is great advice. Yeah. I mean, it's hard when we can't accept something, when we feel like there's no hope, and knowing that there's another side, that you will get over it someday.
Yeah, someday. Whether it's 10 months or 2 weeks, you'll find those nuances. A great doctor helps researching it. The nice thing about prednisone is it makes you paranoid, so you're researching all the time, and hopefully within that paranoia, the byproduct of that comes like, a relationship like this, or finding a really good doctor who knows how to balance the prednisone, who's smart, who's aggressive enough, but like also aware of the side effects. so many doctors that I've gone to will not even give me 10 milligrams. And so my quality of life will diminish. A lot of my friends and my family think I'm crazy for asking for prednisone, but they don't realize it as much as it's like that trading your soul with the devil.
It is.
He's the only one who'll do that trade or give you that trade.
Yeah. So yeah, I've heard you mention Dupixent and Prednisone for asthma. Is there anything else that you've tried?
Yes. So I don't know how this is for other people with autoimmune disorders, and it looks like you are in that whole like finding an alternative, another way, which is, I would love to try Nutranize. I'll probably get online and order it right now, and then maybe it'll come in time before I finish my course so that I can try it and see how it makes me feel, especially maybe before the triathlon. Alternative methods. So Dupixent, thought it worked well. Don't really know how it probably has to build up in my system again. I am on Ceftonir, or sometimes I go on Levaquin, just in case there's a bacterial component. When Prednisone did not really work back in 2019, and I pretty much cleaned out my apartment, like I have to have AC running. It's got to be a brand new apartment built within the last year. Dust can't accumulate. And the one thing I did try that kind of was the cure-all that I haven't gone back to yet is I eliminated oil and sugar from my diet. So I ate whole foods. So I was big on red meat, like grass-fed meat. I did chicken, but like everything organic. And then I would eat within an 8-hour window, just 2 meals a day. No oil, no sugar, no starch, no bananas, no carrots, no nothing. And that just cleansed everything. I was able to get off the prednisone. The asthma went away for an entire year. I was on that diet. As soon as I started adding sugar or like processed sugar back into the mix, things started to inflame again. My body felt like it was attacking, itself. Asthma kind of came back, and I became more sensitive to the pool, to everything that kind of made things miserable for me. So that nutrition was a huge part of it. And so that's what I'm trying to do, is go back to that.
That is awesome.
Yeah.
I highly encourage that strategy, especially the no sugar part.
Yeah.
Because prednisone's a glucocorticoid. That means glucose, sugar. It means it's totally messing with your ability to manage food that you eat that's high in sugar.
Does that mean you should stay off sugar while you're on prednisone?
Yeah, that's what I recommend. And like, if at the very least, processed sugar, at the very minimum, avoid any processed foods while on prednisone, because you just can't handle it. You can't.
Wow. So it like absorbs it or like spits it back into your bloodstream, and it.
Yeah, like normally you have the proper insulin and everything working for you to handle that high amount of sugar that you're putting in your bloodstream. But when you're on prednisone, you have that chromium's missing, and like the gates are just wide open to just leave the sugar there in your blood sugar, which is terrible. Like that just leads to so many problems, from eye problems to cardiac problems, like your heart. All of these problems long-term, like these long-term side effects of prednisone, are so many of them are related to having that high blood sugar. And so by cutting out, at the very minimum, processed sugars, then it really, like, that's like the simplest but hardest thing that you can possibly do, in my opinion.
Crave it too. You crave.
And that's the hardest part, because you crave it. You want to eat an entire cake, right?
Anyway, so that's pretty much what I have for you, question-wise. This was very inspiring and enlightening. And I will make sure to go ahead and talk about Nutranize the next couple of days.
Awesome. So my last question for you is, and I ask this to everybody, what is your go-to snack while on prednisone now that I just ruined it with sugar?
I have several. Peanut M&Ms, coffee ice cream. Last night I had a loaf of bread with butter and cheese, and chicken fried rice. And sometimes all of these 5 within one setting.
I fully believe it. Oh man, what prednisone does to your palate.
Yes, you want to eat everything.
All the things, the entire pantry, especially anything with salt and sugar in it, right?
Yes, salt and sugar. Yeah. Does it mess with your sodium as well?
Yeah, I mean, it's not nearly as bad as other ones, but it does mess with, like, they call it the mineralocorticoid, your water salt balance. And so, yeah, it makes you crave salt because you're peeing out all of the potassium and
Wow, that's another thing. I'm peeing all the time.
right?
Yeah, all the time. And the urge, or like the urethral sphincter urge, like it's like, okay, we gotta go.
It has to go now.
Now. Yeah.
And then you're in there forever, like
Forever.
that scene in that movie with when Tom Hanks, he's the coach and he just like pees and then pees and then pees. A League of Their Own, that's the movie.
Yeah. A League of Their Own. It's not as bad now though at 30 versus like 60, where it's like, oh man, I gotta go. Oh, I gotta go. Like within one meal, it's 6 times. Yeah.
For sure. Yeah. So I'm glad to hear that your diet cravings while on prednisone were like mine.
Or like everyone else's, I'm sure.
Yep. Because yeah, I wanted like the entire package of Oreos, right? And yep. All of those good things.
Right about now. I'm so tempted to get ice cream, but I won't. I'm gonna go fruit, leaves, and meat.
That's a good strategy. I mean, that diet you mentioned is like totally ideal.
Yeah, nothing with a shelf life or like a written expiry date.
Oh yeah, that's a nice way to describe it.
Yeah, yeah. If it's in a box or in packaging, nope.
Nope. Yeah, if you can do that while on prednisone, that is huge.
Yeah, you should start a little forum or a little community for like people who are currently on it. There's a lot of them out there.
Oh, I mean, I actually do have one. My Facebook group.
Oh, you do?
I have a Facebook group called I Heart/Hate Prednisone.
I heart/hate.
The slash is like an actual slash. I hate prednisone. Yeah.
I hate prednisone.
Yeah.
Okay. I hate prednisone on Facebook.
Yep.
And on YouTube, what is your YouTube handle?
It's Dr. Megan Prednisone Pharmacist. And then my website is prednisonepharmacist.com. So 2 of the hardest words in the English language to spell. But if you're taking prednisone, you can just look at your bottle where it says prednisone, and then it will say pharmacy. Just like that. It'll say that. See, it says prednisone, and then it says Walgreens. Oh, they didn't say pharmacy below. Darn it. Anyway, does it say pharmacy on? No, it doesn't. But if you just search Prednisone Pharmacist, you'll get to my website, and on there, I have like hundreds of blogs with tips. Like you can search my side effect list to see, is this a side effect? So like at the beginning, you're like, are hiccups a thing? And you can actually search it and be like, hiccups, because
and I think this thing is a thing too.
Yeah, because there's no great list out there of side effects. If you Google prednisone side effects, the first one will be nausea. Do you get nausea?
No, but I do get like hunger pangs or like ulcer-like pain.
But most people don't get nausea, and actually they prescribe prednisone for nausea for chemotherapy, right?
Chemotherapy, yeah.
And so it's just the weirdest, like the lists you find when you Google prednisone side effects have no basis in reality. I have no idea where they came up with it. It has nothing to do with truth. And so go to my list because it's based on the literature.
Perfect. I've also, like, every time I've taken, I've every day I list the side effects, and they're pretty consistent with 60 the day that I take this, and and like when I drop. And I do have a question. Can you take it with alcohol, or what happens when you like just need a glass of wine to cope?
Yes. Okay. So I have a whole video on blog about that, about prednisone and alcohol. But the takeaway is alcohol messes with your coping abilities to deal with stress. And so it can shoot your system so that when you take them in combination, it can be harder to recover from taking prednisone. And for other people, it's like, this is how I cope with the side effects. So it really depends on like your genetics. Women have a harder time dealing with it. Asians have a harder time dealing with it. All of those factors. It depends. Like I said, for like this one guy I talked to, he was like, I took prednisone for 3 days, went cold turkey, and then I got totally wasted and like completely drunk with my friends 3 days in a row, and now I have no adrenal system. And he's like, tell everyone that don't do that. Don't go cold turkey, and then don't get totally wasted after you go cold turkey.
Okay, so he stopped prednisone and then he like just drank. Does it like get rid of the effect of the drug, or does it like kind of disintegrate the drug, or
no, it's just they're both taxing the adrenal system, like your stress coping mechanism system. And so it can, like in his case, you should never go cold turkey to start with, but in his case, he went cold turkey, and so his adrenal system was like, hey, where's this fake hormone that you were giving me? I need it now.
Yes. And then you hit him with a depressant of alcohol,
and then he gave that alcohol, which also is ruining the adrenal system. And so like he just like completely made it impossible for his adrenal system to kick back into gear. And so he was dealing with serious withdrawals, and I haven't talked to him since, so I'm hoping he's recovered. But like, it's just potentially, it's one more way to make yourself feel terrible. But so other people, they're like, I have no problem. And other people are like, I can't even take one drink while I'm on prednisone without flushing and feeling awful. So it really depends.
Good to know.
Yep.
That's important. Well, thank you. And I hope you have a wonderful day ahead.
Yes. Yeah, I'm so glad you could share your perspective. This has been awesome. Everybody follow Shana's Instagram channel and Instagram hashtag. What is it?
At Shana Dagny, ShanaDagny.
And then you can get all this inspiration, because I love that she's like, this is how we can have happiness, even when there's a pandemic, even when you lose your job,
yes,
even when you're in isolation. This is how you can have happiness. So we need that while we're on prednisone more than other times. So follow her Instagram and get that wonderful inspiration, because even while on prednisone and having the weird personality changes we all get, she still has a contagious, spunky personality. So
I love it.
Thank you so much, Shana.
Thank you, Dr. Mel.
All right, signing off is Dr. Megan, Prednisone Pharmacist.